Good evening. Wish you all a very happy Diwali. On today's Urban Debate Diwali special broadcast, we are going to bring you the stories of those who in the pandemic, who through any festival, forget everything else, their own families, their own lives, simply to serve us, to save our lives across the country. I'm talking about the COVID warriors, the emergency services personnel, our police, our fire department, our doctors and nurses, and the ambulance providers and the ambulance drivers and the healthcare workers across the country, the ASHA workers, hundreds and thousands of them who have been working round the clock ever since the pandemic hit us. We've all had tough years, but the toughest has been for these COVID frontline warriors. So tonight we've decided to speak to some of them, to bring you stories of how even on Diwali Eve, so many of them are working tirelessly for us. We've decided in our own way, pay tribute, say thank you, express our gratitude, even highlight some of the problems that they go through, and how it is that the state governments, that the central government, you and I can be supportive towards our COVID warriors, our frontline warriors. Let me just tell you some of the hardships that they have gone through in 2020. Over 87,000 health staff has been infected. Over 570 have been killed during the COVID time. There have been maximum healthcare staff casualties and deaths in the state of Maharashtra. In fact, even if you ask the IMA, their own data suggests 515 doctors have died battling for COVID. The government doesn't have any official data, so we stick by what other news agencies and healthcare associations have given us. And so even if you look at the numbers of those who've been infected and those who've gotten some benefit out of the Pradhan Mantri Garib Kalyan Yojana scheme, or even the scheme that's been put out for our frontline warriors, very small percentage of them have actually got any support or benefit from the government. We're going to talk about that as well. But the kind of trouble and pain that they have gone through deserves a salute from us tonight. Long work hours, no leaves, no proper time to rest, shortage of staffs adding to their burden, lack of protective gear, more exposure, more risks towards COVID, having to stay away from their own families, sometimes not in the same house, living separately, or even in the same house, but unable to interact with their own families because of the fear of the pandemic spreading and the infection spreading. The psychological burden of all of it, add to that stigmatization and ostracization that is still happening in some parts of our country. So this Diwali, viewers, let us all take a moment before lighting the diyas and sharing sweets and wishing our family members and our loved ones. Let's stand up and salute the warriors who sacrifice their good times, their peaceful times for our good. I've opened up the phone lines as well. You can join me in this special conversations. The numbers will be flashing on your screens. Before I go across to our special guests who are joining us this evening, I want to go to two different cities and our reporters on ground. Sreeja is joining us from Banaswadi Fire Station in Bengaluru. Alok is live from the Connaught Place Police Station. Sreeja, first to you. One department emergency service that is even more busy during festival time is the fire department, away from their own family men. Let's see if you can talk to some of them.
Well, that's right, Tanvi. In fact, firstly, wish you a very happy Diwali, and also to all our viewers. And of course, remember, Diwali celebrations are not complete without sweets and, of course, prayers. And the most important people, in fact, who play a big role over here are the firefighters, who ensure especially everybody's lives are, in fact, safe. And just about a couple of minutes ago, right from this very station, the OMBR, which is the Banaswadi Fire Station, what we did witness was especially the fire officers just left, in fact, from this very station because they received an emergency call saying that the transformers have went up in flames. Now, what you see right behind me is especially where they have received an emergency call and they want to leave. Now, this is the regular kind of a service which they carry out on a daily basis, and of course even Diwali is no different for them. Now remember, these are the same firefighters whose families in fact wait at least for once they come back home, but of course what they tell us is that this is the time where they clearly cannot go back home. Now, if I can go across to one fire officer right here who's joining us, Mr. Manjunath. Well, thank you for joining us here on the show. Firstly, sir, if you can tell us about, the kind of challenges, especially the firefighters face. And remember, it's Diwali, the celebrations. Of course, you'll want to go home, but clearly y'all cannot because your service is something that counts for y'all most important.
In Bengaluru, we majorly face traffic problem. That's why we are having different kinds of vehicle. Agni, there is a two-wheeler. In emergency, every seconds count. We have to reach as early as possible because we have to save the life, save the property, all those things. We have one Agni bike in our station, one mini water tender having 3,000 liter water capacity, and we have two water tenders having 4,500 liters of water capacity.
Okay.
And there's a major fires. In case of major fire, we are having water bowser of having 16,000 liters water capacity.
Okay. Okay. Also, if I could just go to another officer who's joining us here. In fact, he is the person who tells us that he takes the alert calls, the first thing that they receive from the control room, and then it goes on to the station that is a fire station. Now, if I can go across to him to find out what really are the kind of challenges, the first alert that he receives. Well, thank you, sir, for joining us firstly. Happy Diwali to you. Can you tell us you were talking to us about the tab, the alert calls that you receive?
Yes, good evening, madam. फर्स्ट हम कॉल रिसीव किया तो ये टैब में मैसेज आता मैडम कंट्रोल रूम से, फायर कंट्रोल रूम 101 से मैसेज आया तो हम यहाँ एक्सेप्ट असेंड टू मी ये मैसेज का दिखा था मैडम टैब में. नेक्स्ट इंसिडेंट लिस्ट असेंड टू मीन अभी ये मैसेज आया तो एक्सेप्ट किया तो हम वो फायर कॉल को अटेंड करना मैडम. ठीक है मैडम, वो अटेंड करें तो यस बोला तो हम हमारा व्हीकल कहाँ से मूवमेंट हो रहा है सब कुछ पता था मैडम ये टैब में मैडम. फिर हम टेलीफोन रूम से ये लेता मैडम एड्रेस प्रूफ लेके वो कहाँ है स्पॉट उसके जाके वहाँ जाके सब कुछ कौन सा टाइप इंसिडेंट है वो अटेंड करता.
What kind of incidents do you attend, especially during the Diwali season? What are the kinds of calls that you receive?
In crackers, in both different type of crackers and coconut tree. You put फायर यहाँ नीचे से वो तो ऊपर गया था ना ट्री में, वो ऐसे जाके फायर होता वहाँ से हम एक्सेप्ट करके टैब में रिसीव करके वो स्पॉट में जाता मैडम.
Okay, how many minutes do you all take?
यहाँ से हम लेफ्ट होने के लिए 1 मिनट में सब कुछ आदमी यहाँ से लेफ्ट होता है मैडम स्टेशन से.
Okay, so you all ensure everything is covered within a minute.
1 minute.
One most important question I would like to ask you is that every Diwali, whether it's Diwali or any festival, you're out there and also providing your service, firefighting service. But what about your family members?
Oh, family member is different, madam. Our department, Karnataka State Fire and Emergency Service, our motto is we serve to save. Okay, yeah, that's me.
Do your family members expect you back home, especially on Diwali? Do they ask you to come back home early?
मैडम अभी एक लेना तो एक छोड़ना, जिसके लिए हम फर्स्ट सर्विस फर्स्ट आफ्टर फैमिली मैडम.
Okay, well, that's what you heard from a firefighter here who's telling us that, of course, the service that he does is something that comes first and then family second. Now, if I can go across to the senior officer who's joining us over here. Well, thank you, sir, for joining us. If you can tell us, as compared to last year, also, usually what is the maximum number of calls that, a fire station
receives? City fire call receive details will be available in CFCR, City Fire Control Room is there in Sheshadi Road. Okay. And that place you give the details of the fire call details also.
Okay.
In that you take the call, to pass the message to the nearest fire station. The fire station receive the call. After they receive the call, to turn out the vehicle to reach the spot. If it is more serious fire call is more. Fire is more since the first person is going to give a message to the fire officers to send another more vehicles also.
Okay.
Sreeja,
so can you
if
recall
you can hear
any
me,
of the biggest
Sreeja,
challenges
if you can
that
hear
you
me.
faced during the Diwali season?
So many fire calls occurs.
Yes, Tanvi, yes.
Sreeja, if you can also ask the senior fire officials there, if COVID has made it more difficult in terms of staff shortage, how many of their team members from that fire department of a station have had to, suffer or have been infected, and how have they tackled that kind of a shortage?
Yes, of course, Tanvi. In fact, I did speak to him about the strength over here. He was telling me that there are at least about 35 personnel who work at this particular station, the fire station, and they work round the clock, which means they are working in 3 different shifts. Now, let me go across to him about the challenges as far as COVID is concerned. So, one important question that I would like to ask you is, it is a pandemic situation right now, and we understand it's a huge challenge as well. In your team, in terms of if at all there has been a staff shortage or anybody's been infected with the virus, how are you managing?
In this fire station, no, there is no COVID patients.
Okay.
The other fire station having COVID patients take the precaution measures as per department officer, give a direction from our senior officers.
Okay.
Every person's every station having a sanitizer, mask, and are also used every day. So.
But in case there is a situation as far as the shortage, only because of there are personnel affected, what?
There no chance shortage of the staff. Arrange the nearest fire station to send the vehicle to the fire call and other rescue calls also. Madam.
Well, thank you, sir. Thank you for that. Well, Tanvi, he tells us that usually when there is such kind of cases, especially as far as shortage is concerned, they immediately call up the nearest fire station and they fill in the personnel. So this is exactly how they have been working, and this is their Diwali. In fact, Tanvi, all that they tell us is that, of course, this is an every year affair. They clearly cannot go back home, even if their families are still waiting for them to come back home.
Oh yes, absolutely. Festival time for all of our law enforcement agencies and emergency services are always the busiest time. Sreeja, do tell them, do express our gratitude from the entire Mirror Now's team to them, and of course wish them happy Diwali from our end. Alok, let me come across to you. Busy time also for police personnel, but tonight we want to hear stories, from the Delhi police personnel, but how 2020 has been for them, and when was the last time they actually managed to celebrate any festival with family?
Yes, Tanvi, difficult time for these frontline warriors. First, this is a Connaught Place police station, and here this is the way that they are celebrating their Diwali. In fact, today is Choti Diwali, and they have lit the candle and also diyas, earthen pots. In fact, if we go inside the police station and we'll show you that what's all going on inside the police station. In fact, duty officer room is very important, and in fact here you can see that the duty officer is sitting and he is in fact taking a call as well. The other facilitation desk and other rooms are there. CC tennis room is still there. Is a woman staff. She is also busy with the work. In fact, very interestingly, that this is the sanitization machine is also kept over here. If you go and talk to this cop, in fact, he's a little bit busy right now. Sir, 2 minute अगर आप बात करना चाहें, बहुत busy हैं, और यही busy जो रहते हैं वो आप मतलब अगर हम कहें तो पूरे 12 महीने busy रहते हैं. और सबसे बड़ा चीज़ जो रहा पूरे दिल्ली पुलिस की बात करें, कई पुलिस वाले जिंदगी से भी हार गए. हमने देखा कई साथी आप लोग के गुजर गए क्योंकि कोरोना का काल था. लेकिन इस चीज़ों को देखते हुए किस तरीके से आप उभरे और कैसे काम कर रहे हैं, कितना डिफिकल्ट हो रहा है आप लोगों को कोरोना के टाइम पे जनता को भी देखना, कॉल्स भी अटेंड करना और साथ ही साथ परिवार को भी देखना?
सर, कोरोना के टाइम पे स्टार्टिंग में थोड़ा सा डर तो लगा क्योंकि इतनी भयंकर बीमारी थी, लेकिन धीरे धीरे हमारे सीनियरों ने हमारा हौसला अफजाई की, हमें मेडिकल किटें दिलाई, उनको हमने डेली लिया और हाँ काफ़ी हिम्मत बढ़ाई.
परिवार को कैसे समझाते थे, क्योंकि आप लोग तो फील्ड पे रहते थे?
सर, परिवार भी हमारी ड्यूटी देख के वो भी हमारे जैसा ही हो गया. उनको पता है कि ड्यूटी के बाद ही घर आएंगे, चाहे कुछ भी हो जाए, इनको ड्यूटी पहले करनी है, देन उसके बाद फैमिली के पास पहुंचना है.
अभी भी आज जैसे दिवाली का माहौल है और दिवाली है, बेसिकली आज छोटी दिवाली है तो आज भी मनाई जाती है, कल भी मनाई जाएगी पूरे फुल जोशो खरोश के साथ. तो परिवार को किस तरीके से समझाए, कम से कम दिवाली पे जा सकते थे वो भी नहीं जा पाए?
सर, ये तो जब से नौकरी लगे हैं, मेरी 23 साल की सर्विस हो चुकी है, 23 साल में मुश्किल से 4 या 5 बार अपनी फैमिली के साथ कंप्लीट दिवाली मनाई है। नहीं तो अपनी ड्यूटी कंप्लीट करके ड्यूटी से फ्री होके लेट नाइट में ही घर पहुंचते हैं, तब तक दिवाली हो चुकी होती है। लेकिन वही बहुत है बच्चों के लिए कि हम घर पहुंच जाते हैं।
ये आज अभी कितने बजे तक आपकी शिफ्ट है?
मेरी रात के 12 बजे तक है। जी सर।
ओके, सो दिस इज वन ऑफ दी, आप रहने वाले कहाँ के? हरियाणा के?
जी, हरियाणा से बिलोंग करता हूँ मैं, नेटिव मेरा हरियाणा है।
So this is one of the head constable who is deployed over here, and he is the duty officer. Very important job he is doing because he attends the first call. Tanvi, around 80 police persons lost their lives in the national capital because of the corona, and in fact the police station is station house in charge as well. Sir, कैसे manage कर रहे हैं यहाँ पर, खास तौर पे जब कोरोना का टाइम था उस टाइम पे क्या किया, और अभी जो स्थिति है, स्टाफ है आपके पास या कमी रहती है स्टाफ की? क्योंकि अब दिवाली है, दिवाली पे भी कई सारे पुलिस वाले भी चाहते हैं घर जाएं, छुट्टी भी देना पड़ता होगा कुछ की जिसकी इमरजेंसी होती है, तो कैसे मैनेज करते हैं सर?
जिनको बहुत ही ज़रूरत होती है छुट्टी की, उनको हम छुट्टी देते हैं। और अभी भी कुछ लोग गए हैं छुट्टी पे, लेकिन जो लोग अब ड्यूटी पे हैं वो पूरी तरह से डिवोटेड हैं और उनको पता है कि हमें, हमारे लिए हमारे त्यौहार से ज़्यादा लोगों की सुरक्षा ज़्यादा ज़रूरी है। तो वो सब अपने अपने काम में लगे हुए हैं।
आपके थाने में भी कोई कोविड अफेक्टेड हुआ था जिस टाइम पे कोविड चल रहा था?
जी, हुए हैं हमारे यहाँ भी। टोटल 6 लोग हुए हैं अब तक पूरे टाइम में।
सब रिकवर हो गए सर?
सभी रिकवर हो गए, सब ठीक हैं।
हाँ, तो उनमें से भी कोई आया काम पे वापस?
जी, सभी ड्यूटी कर रहे हैं। जी हाँ, जी हाँ, कर रहे हैं।
कैसा रहा सर उस टाइम पे? कोई सिचुएशन ऐसी, कोई डिफिकल्ट टाइम रहा हो जिस टाइम पे कोविड चल रहा था? अभी भी चल ही रहा है, मतलब अभी भी कोई ऐसी चीज़ होती हो जो आपको लगता है कि बहुत ज़्यादा डिफिकल्ट आप लोगों को महसूस होता हो, क्योंकि दिवाली पे भी आप लोग काम कर रहे हैं?
जी जी, बिल्कुल ही नई समस्या थी हमारे लिए, हमने कभी ऐसी समस्या देखी नहीं, और एक चैलेंज था जिसको पुलिस ने चैलेंज के रूप में ही लिया, और हम लोगों ने बिल्कुल आगे बढ़ के काम किया। उसमें पुलिस का बहुत ज़्यादा योगदान रहा कि जहाँ भी कोई समस्या आती थी लोगों को, हम लोग आगे थे।
डिस्ट्रीब्यूशन वगैरह?
जी हाँ, जी हाँ, अपनी भी सुरक्षा और फिर लोगों को भी सुरक्षित रखना।
ये चैलेंज अभी भी चल रहा है?
जी, अभी चल रहा है। ये जो अभी फिर से थोड़ी दिक्कत आई है, तो सोशल डिस्टेंसिंग और मास्क, ये इतना ज़रूरी है कि हम रोज़ सिक्योरिटी के साथ साथ ये भी अनाउंसमेंट कर रहे हैं, लोगों को जागरूक कर रहे हैं कि मास्क लगा के रखें और सोशल डिस्टेंसिंग बना के रखें।
कनॉट प्लेस का एरिया वैसे भी बहुत ज़्यादा,
जी, काफ़ी सेंसिटिव है, और सिक्योरिटी पॉइंट ऑफ व्यू से भी हमने इस दिवाली काफ़ी सुरक्षा बरतने की और काफ़ी टाइट रखने की कोशिश की है।
सर आप यहीं से हैं या आप कहीं बाहर से हैं?
जी, बाहर से हैं, बिहार के रहने वाले हैं। जी जी।
कितने साल हो गए आपको सर्विस?
लगभग 31 साल हो गए।
कितनी बार दिवाली घर पे परिवार के साथ, फैमिली के साथ मनाया?
बहुत कम मौका मिला है, क्योंकि मैं पुलिस स्टेशन में ज़्यादा रहा हूँ, और ये हमने हमेशा चैलेंज के रूप में लिया और इस ड्यूटी को बखूबी निभाया है। तो घर जाने का मौका दिवाली और दिवाली के आसपास बहुत ही कम मिला है।
So this is the view, and definitely we salute the work they are doing, because
Alok,
they
if
are
you can
not
just
only
ask
protecting
any
us,
of them one
saving
more
us
question, maybe
from
the senior officer of the police station that you were just talking to, the mental fear, which is what the first cop was saying, because वो front line पे हैं, सबसे ज़्यादा interaction रोड पे लोगों के साथ, law implementation, जब criminals को पकड़ना हो, investigate करना हो रहता है, तो वो खुद को कैसे उन्होंने वो fear overcome किया कि जब वो बाहर निकल रहे हैं और ये कोरोना का रिस्क रहेगा, उसको उन्होंने अपनी टीम को और अपने को कैसे समझाया उस बारे में?
जी जी, बिल्कुल बिल्कुल सर। जो सबसे बड़ी चीज़ है जो हमारी एंकर पूछ रही हैं, आपसे जानना चाहती हैं कि जब कोरोना बहुत ज़्यादा, मतलब है तो अभी भी, लेकिन जिस तरीके से जब आप लोग पकड़ते हैं, क्योंकि आप लोग फ्रंट लाइन वॉरियर्स हैं, बदमाशों को भी पकड़ना है, साथ ही साथ पब्लिक डीलिंग भी करनी है, और पेश भी करना है। जब बदमाश को पकड़ लिया, बाद में पता चलता है कि बदमाश कोरोना पॉजिटिव निकला या कहीं से उसको इफेक्ट हो गया। ये सब चीज़ों को, चैलेंज को कैसे आप लोग मतलब इससे कैसे निकल पाते हैं, और कैसे इसको आपने दृढ़ के साथ आगे बढ़ाया?
जी, ये एक तो समझ सकते हैं प्रोफेशनल हैजार्ड है। अगर एक क्रिमिनल है और हम पकड़ते हैं तो पकड़ना ही है, उसमें जितनी सुरक्षा हम रख सकते हैं, जैसे इमीडिएटली हम अगर किसी को काबू करते हैं, किसी क्रिमिनल को, तो उसको मास्क देते हैं, अपना ग्लोव्स और उसको भी ग्लोव्स लगवाते हैं। कोशिश यही रहती है कि थोड़ा डिस्टेंस रहे, ताकि कम से कम पॉसिबिलिटी हो अफेक्ट होने की।
और जो आपके स्टाफ होते हैं उनको भी क्या करते हैं आप लोग, कैसे करते
यही है, मतलब डिस्टेंस प्लस मास्क हम क्रिमिनल को इमीडिएटली देते हैं। अगर पहले से है तो ठीक है, नहीं तो उसको मास्क लगवाते हैं। और हमारे लोग ग्लोव्स लगाते हैं और अपनी सुरक्षा, बस अपनी और उसकी भी सुरक्षा मेंटेन करने की कोशिश करते हैं।
This is what their view is. Definitely, as I already showed you, that there is a machine that is kept over there, and they are kept doing this exercise, that they are sanitizing this whole police station and again. So this way they are just making all the assurance. They are doing all the precautionary. They are taking all the precautionary measures so that that the corona could not affect, and they could save everybody and save themselves as well. So definitely we salute all these frontline warriors who are working, especially on the day of Diwali. Back to you.
Oh yes, absolutely. Through the pandemic, through the lockdown, through any disaster, through festival season, you know, our frontline warriors always on the job. Must thank them for that. We often ask our Delhi police very tough questions on critical issues, but we are also grateful for them, to them for doing the job and keeping us safe. Thanks so much, Sreeja and Alok, for joining us and bringing us those voices from the fire department and, of course, from the police. Let's also say good evening to Usha Banerjee, Group Director of Nursing at Apollo Hospitals, joining us this evening. Dr. Tushar Patel, pulmonologist and critical care specialist at Sterling and KD Hospital, also a member of the Gujarat COVID Task Force. Manish Sacheti, co-founder and CFO of Zikitsa Healthcare, and Durgesh Prakash, an activist, also part of the Asha Workers Union, with us this evening. In fact, Usha Banerjee, let me begin with you. You know, another and perhaps one of those professions that's had the toughest year has been the healthcare profession. You know, help us understand, how did you all cope with it, cope with the stress, with the pressures that come along?
Good evening, Ms. Tanvi, and thank you so much for having me up here on the show again. I must say that while the world is gearing up to celebrate Diwali with their family and friends, your cameras are focused on the essential staff who are denied the privilege of being back home with their family and friends. While it all began this year, we thought that probably while the year comes to a close and when festivities begin for Diwali, we would see a lot of people trying to go back home because the staff are fatigued and they've been away from home. They are mentally exhausted, they're physically challenged. But unfortunately, we see a trend, especially talking about being at Delhi here. And a lot of staff are today working at the front line and the back end, trying to battle this invisible enemy. And many of them who looked forward to being at home today are right there at the bedside, managing the patients. So there is a lot of joy and cheer around, but we as COVID workers and as nurses especially, who are right there at the patient's front end in close proximity, are wishing that this country sees a better tomorrow. And we say a silent prayer to all those who have lost their lives. And we wish every individual behaves responsibly this time during the festivity, so that we do not see a surge and a spread, and we remain unaffected by this COVID disaster that we are faced with. That's the entire workforce praying for the nation today.
Yes, absolutely. Usha Banerjee, in fact, you know, that point that you made, very important. Our healthcare professionals wishing that everybody else follows the norms, you know, tries to be a little careful so that we don't have too many cases. But unfortunately, Dr. Tushar Patel, what we are looking at is a, you know, possibility of cases going up. You know, some are calling it the second wave, some are saying post-festival spike and surge that we are going to witness. So while all of us are trying to de-stress a little, socialize a little, try to normalize our life, I'm sure this is also a big scare for the healthcare professionals thinking of what may be coming up next.
Yes, you saw this. More cases are upcoming in this last week. This is a winter month is started, and you see in USA, also in European country, all the countries are cases is gone up. And so in our India also little bit gone up cases, but not much much more cases is up due to this pandemic. We are also working since last 8 to 9 months, and I salute to all our healthcare workers, those all doctors, paramedics, and all those who are working since last untiredly works for 24/7 up till now. During festival month also they are working very hard, and due to this festival month and all these things, we had also similar like the staff crisis is also occur, because they are working day by day continue, and they are also tired. So all these condition distressing is also required, but all the citizens of our country, I request to maintain the discipline like government says ki SMS. So sanitization, mask, and social distancing is kept, because if we are not keeping this such type of distancing up till we are not getting a vaccine, because up till we are not getting a vaccine, mask is a vaccine. We are keeping a mask is a vaccine. This slogan in our mind, because we are keep our healthcare worker healthy and to serve the lots times.
Yes, masks, sanitizer and social distancing. These are the things that people should remember. The visuals, of course, that we see coming from across the country are a little scary. But let me come back to talking about all of you, our frontline warriors. And the question that I want to ask Durgesh Prakash, Durgesh, even, for the ASHA workers, the challenge to go out there every day, to interact with people, to put themselves, expose themselves to the risk of infection every day. 8 months down the line, how has it become, have ASHA workers kind of accepted this as normal life now for many, many months to come?
Yes, I think not only during the present pandemic, the COVID-19, but if you also remember way back in 2015 when the Nipah virus outbreak happened in probably in many parts of Kerala, all the ASHA workers were alerted and were told to be deployed and to work among their communities, among their local work groups. And if you see, ever since the pandemic outbreak happened in India since March, I think more than 9 lakh ASHA workers across India were seemingly deployed to work relentlessly among their local communities to avert the pandemic. And ever since then, probably before the pandemic also, if I may, the ASHA workers will always be in the first page of any delegations or assignments. Because they are social facilitators and social service providers, healthcare service providers, so they will always need to be active among the communities they work in, but also the challenges that they faced during the pandemic because of the fear, the distrust during the pandemic. Many people in local areas, ASHA workers had to bear the brunt of assaults. So many of them were beaten up, so many of them were abused, saying that not to enter their area so that the disease contracts. And apart from all these things, as you rightly told, they have to bereave their families. Many of the ASHA workers, family members or husbands are majorly daily wage workers, or construction workers or drivers. And in that case, the meager amount that the ASHA workers are earning for the service, the selfless service they are doing, is way below the minimum wage of which is currently in India, less than 5,000 rupees. And in fact, I would like to share an incident, if I may. In Bangalore, one of the residents where the ASHA workers are working, the residents called up to me thinking that I am the decision maker in the government. I represent the union, in fact. Told me that I was shocked to hear that this ASHA worker is earning less than 5,000 rupees. I thought she will be earning more than 20 or 30,000 rupees for the work she is doing. From day to night, she comes to our house. So, the ASHA workers are not merely doing a service to the community mechanically. They are very emotionally attached to the community, to the people among them. The people are actually in wanting of them. there is a deep relation among the ASHA workers and the people they work with. These are the points that I would like to highlight here.
And thank you so much. You're making some very valid points. Every time we saw one of those visuals come in, it broke my heart when ASHA workers out there in the field being attacked. And in fact, the fact about our healthcare workers not being paid properly, not being paid on time, all of the rhetoric that and all of the special dedicated events that we have and days that we have where we cheer, where we clap, where we light our diyas for healthcare workers really means nothing until and unless we are able to actually stand by our healthcare workers and fix the problems that they actually face. Manish Sacheti, thank you so much for joining us as well. The other important aspect is, and literally the front line of the front line are the ambulance services, the emergency services. How has the year been for your team personnel to go out there day after day, face the pandemic and face the extra burden that comes along with this pandemic?
Good evening, Tanvi. Can you hear me?
Yes, I can.
Yeah. Firstly, I'd like to wish you a happy Diwali.
To you too.
Thank you. So, Tanvi, it has not been easy. Last 7-8 months, we've had situations where we've kept the ambulance staff has actually not, to a great part, not gone home. They've been working for like a month at a stretch and gone home only after completing 1 month, let's say, so that they don't go back home and infect their family members, right? And the other thing is, in the initial days when the corona was like a big threat and people didn't know what it was exactly, convincing and having them go on the field, handling COVID patients was quite a task. Although nobody, I mean, out of the 10-12,000 people we've had no case of anyone saying no to go to duty. So, one, the mental stress they had to go through, staying away from family and dealing with the COVID patients was quite a trauma. And we have had counseling done for them so that they understand and they don't get stressed out. The other thing is during this initial period when COVID broke out, there was a major short supply of equipment. When I'm talking about equipment, I'm talking about face masks, I'm talking about PPE kits, and I'm talking about sanitizers. Just fighting and struggling to get the face masks and sanitizers, etc., was also a big challenge, which we had to undergo. But we did, and we ensured all our ambulances, all the 10,000 people, and the patients that we cater to got the equipment. Even in that period, you had a situation where you got equipment, let's say the face mask in Delhi, but the transportation had been shut because of the all India lockdown. So even moving goods around was difficult.
Right.
So it's been a challenging period for us. But
yes.
All the staff members have supported us fully.
Well, I think we should salute their bravery that they have, even in such times, not run away, not come up with excuses to not turn up to work and face the challenges of not even sometimes, or struggling to have the safety equipment as they step out every day. And I know, the way it can play on anybody's mind, I mean, even in our profession, for our team members to come and ensure that we keep the operations going, keep bringing the news. I know the kind of toll it can take mentally on anybody, and 100 times more, of course, when it comes to the healthcare professionals. Do stay on with us, all of you. I just want to bring in a couple of our viewers also, and allow them to also join us in expressing our gratitude to the healthcare professionals, emergency services professionals as well. Ramesh Kumar is on the phone line from Chennai. Good evening, Ramesh.
Good evening. My wishes to you and to your team. We have been praying every day for the special frontline people who are a part of our daily prayers. We have been praying for their health, for the excellent work they have been doing to us. It is not only our prayers today or yesterday. It will continue in future also. We are thanking them and we will be thanking them. And every Indian will be thanking them throughout their life for the excellent work they have been doing. I once again wish them, their family, and also our prayers are always with them for their good health.
Thank you so much, Ramesh, for calling and sharing, your views and sending your wishes as well. I've got a caller who's on the phone line from Noida, who's asked to remain anonymous but has a story to share. Good evening. Go ahead, please.
Good evening. I was watching your program. I'm infected with coronavirus and I am admitted in the hospital 3 days back. I want to share that, on this Diwali, you are doing a special show. We used to watch TV and media for 6 months, praising the frontline workers and so much they are doing. But I never expected that my entire family will be infected during Diwali with coronavirus. And once they were infected, we can't share with you how these doctors, the sisters, I'm admitted in a hospital in Kaushambi. Right now I'm alone in the room. Tomorrow is Diwali. My son is alone at home. But all these frontline workers who are here, they have become my family on Diwali and they are keeping us awake and smiling. My urge is that please do not catch up with anybody on Diwali, because we all feel that catching up with 2-3 people will make us celebrate this festival. But, we all got infected in the process. We were only 4-5 of us, and none of us are together today. And our only family is the frontline workers, the doctors. They are here at 5 in the morning, and I'll be here for the next few days. But they are my family, and I have we can't even tell you how hard these people are working. And right now, my mother, she will also be admitted tonight. I was just told. So the doctors have just come and told me that I will have a companion now, and they are there for us. That is the level of emotional support, other than standing here and working day and night and making us smile even during festivity. Please do not be casual. Please do not celebrate, go out, or do anything at the cost of your health.
Yes.
And really, big salute to every person who comes, cleans my room, who gives me water, who's making me smile, the doctors, who's injecting me. There is a person in the pantry in this hospital. He carries a Bible in his pocket. He prayed for me today. He put the Bible on my head. And believe me, he said that tomorrow your Bible will protect you. I don't want to go for any religion. I'm a Hindu. He put the Bible on my head, but it is just the gesture of this frontline worker,
right,
who is making me sure that I smile and I recover with good health. So please, and thank you for doing this show. And please tell the youth not to mess with their health by meeting on Diwali. It's a request.
Well, thank you for calling, and we are going to hope and pray that you and your family also recover very quickly and are all back together. But thank you for also putting out that message so that others can keep this in mind as well, that it's still not a good time to let our guard down. You don't know what's around the corner. Thank you. I appreciate you calling us and, sharing your experiences with us. I think it matters a lot. And before I go back to our panelists, one more viewer on the phone line from Delhi. Calden is on the phone line. Good evening. Go ahead, please.
Good evening. Thank you for giving me this opportunity. I would like to thank all the doctors, nurses who are taking care of patients and who are risking their life. I thank you so much for everything you have done for this country and for the people. And happy Diwali to every one of them. Safe Diwali to everyone. And I request all the people in India to please keep the social distance and please wear the mask. Take care. COVID is teaching us something unique. It's teaching us empathy and compassion. And we must come over this.
Yes, absolutely,
together.
Calden. Thank you so much for calling in for your wishes. If I can just go back to Dr. Patel and then Usha Banerjee. Dr. Patel, one important aspect uh, during the pandemic has been the mental, the psychological burden for the patients and for the frontline warriors, because not only do you have to overcome the fear and the burden for yourself, then you have to go there and, you know, also tell the patient to not get anxious, to not get worried, and to, you know, how to deal with their own isolation and anxiety. How have you and your team members coped with that?
Yes, this is anxiety all over this our country because of this anxiety and all these things. But our patient is so much panic. Once patient getting the report of, sir, I have a positive report, so they are much worried. But I tell them, not don't maybe panicky or anything. You are cured now. You saw all over India and all over a country recovery rate is more increased 90, and the death mortality rate is also decreased. So you cannot corona cannot kill you. Corona cannot, if you afraid, then corona will kill you. This is I give assurance to my patients. But also other side, our healthcare workers, me, and all these are people also afraid, because when every time we are going to home and we check our temperatures, our body, I also go to the home, and at that time also my wife is also touch me, you know, any temperature or anything. So all the time, our side is also afraid, and our healthcare workers, because most of them in our hospital also more than 50% our more than 50 to 70% healthcare workers are also affected in the hospital. So both side anxiety, stress level is there, but we are doing working, keep our working. If our staff is might be affected, then I tell them, you all right, within a 2 or 4 to 5 days you see all the patients are also all right, so they are all keep away their anxiety, and they are doing after 5 to 7 or 10 days quarantine period is over, then they are come on the work. So this type of psychological support I give both sides, for patient and for doctor sides.
Yes, Usha Banerjee, would you like to weigh in on this as well?
Oh, well, I want to say that anyone who is affected by COVID, whether it is a healthcare worker who's working in the COVID unit or it is a patient, everyone goes through an emotional roller coaster. While there is this indomitable spirit to fight and a compelling conviction, I think it is emotionally very draining, very challenging. So, for a healthcare worker to deal with their own emotions, anxiety, fear, and distance from family, also to deal and cope with the emotions of a patient is equally challenging. And I think the healthcare workers of us have seen a lot in these last few months. While they've seen patients, we just heard a patient talk about how the entire family has been affected because of being COVID. We've seen people whose marriages closed but could not be held. I'm talking about the staff, and they could not go for their marriages just because either they are COVID or somebody's had COVID or somebody died with COVID in their families. There are many people who are affected so emotionally. So as a responsible hospital, and I speak for Apollo Hospitals Group, I'm glad we have very well laid out protocols. We have a lot of psychological counseling sessions for nurses, for doctors, and for other workers. We try to engage them, try and address their grievance, try and help them cope with their anxiety and emotions. And I think that's helped us quite a bit.
In fact, that's something that you know, I also wanted to ask you, Usha Banerjee, that initially when the pandemic hit us, we all thought that it's just going to be for some time, for a few weeks, things would get better. I mean, I remember in March, by the end of March, when for the first time we were talking about the concept of isolation and social distancing, and the experts told us that we may have to live like this through the rest of the year. And that was so difficult to imagine to do. But similarly, for the healthcare professionals, to make this a way of life, to every day take all these precautions, wear those PPE kits, wear those masks, 12 hours, day in, day out, change, take precautions, go back home, wash up, sanitize before you even come close to any family member. That I think must be the most difficult part. How do you tell them that this may be how you have to live your life for at least another year, if not more?
Oh, it's very, very tough. Many of us don't even get back home. And those who do, and largely many of them have small children, aged parents, people have illness at home, staying away, social distancing, washing up, cleaning up, looking after the household routine has physically drained all of us. And the only prayer we have every single day is that our country sees a downward trend in COVID and get back to our normal lives. And unfortunately, that has not happened. We all thought when it started off that November, December could see us some better situation. But I don't think that it is ever going to go away. But at the same time, I feel that we could have been socially more responsible. And then we could have not had this kind of a situation today. Many of our healthcare workers could have gone home and celebrated this Diwali with their family and friends too. So my only urge is that we take this as a great responsibility. We should not celebrate in groups. We should not be casual in terms of distancing. We should not forget our masks. And this is not for today. And I see it at least for a year to come.
Yeah, absolutely. In fact, Durgesh, if I can come to you on that before I go across to more viewers who are on the phone line, and we are flooded with calls. I must tell all of you that we're getting calls from across the country from people who want to send their best wishes, and express their gratitude to all of you. But Durgesh, again, the psychological aspect of it, of course, for an ASHA worker, it's even more difficult because already you're working in tough circumstances. You have to go out on a daily basis. You're not even being paid properly. Then there is the risk of being attacked and targeted, at any given point. How does one tackle that? Or is it just that, well, this is life, this is how it is, we will deal with it?
I think, as Dr. Usha Banerjee rightly pointed, it is more of an emotional and physical draining that happens over the past 7 or 8 months. Nowadays, the ASHA workers are leaving their houses at 5 o'clock in the morning, and they come back at 5 in the evening. Many of them come back, work even late nights, and some of them complete the 6-hour shift. But the most important point is when you look at the houses where the ASHA worker resides, it is merely a very small house where you can't even think of being socially distant from your family members, as they belong to a marginalized section.
Correct.
And most of the issues that the ASHA workers are facing is when they have to leave their child in their homes and go to works, while their husbands are off, for their daily wage workers. The point is where to leave their children. So they can't take their children to the primary healthcare centers. They can't take their children to the areas they work in because of the danger of contraction. And they can't even leave their children in the neighboring houses because many of them have complained that since your mother is an ASHA worker, so we might also contract the disease. So this is a huge challenge that emotionally as well that they have to deal with, and and also my opinion or appeal to the government is why can't ASHA workers be deployed in dual shifts? Some may work in the morning, some may work in the evening, where more number of women can also be employed as ASHA workers, and also the community health care or health service can be reached to a large section of people, which was basically the intention of forming the ASHA program in 2005. And I also want to highlight one aspect. When the program was actually formed, the ASHA program in 2005, the mortality rate of child mortality rate in India was very high. The pregnancy death rates were very high. Ever since the ASHA program has come into being, going by the data, there has been a significant 77% decline in the death rates. And more than 80% of women in rural areas and urban areas are being encouraged to come to the healthcare institutions for deliveries. So Asha workers have played a very significant role, not only in the containment of pandemic, but in the overall healthcare system that we are living in. And in Karnataka, there have been attributions to the Asha workers as they are called walking gods by the local politicians or the bureaucrats. And often the Asha workers say that we are merely being praised, but let the praise come through in the form of increasing or improving our livelihoods, increasing our salaries, getting better facilities, to our works that we render.
Absolutely. And in fact, now would be a good time to drive home this point with our governments. Often, ASHA workers across the country are ignored, their work undervalued for what they do. But if we don't realize and recognize now in times of a pandemic, then we would really be, doing a great wrong there, which must be fixed. Let me go across to Kanchan. Kanchan's also calling us from Bengaluru. Good evening. Go ahead, please.
Yeah, hi, good evening, everyone. First of all, I want to give salute to everyone, be it a frontline worker or media or exchange, financial markets or RBI or the BJP government or any government. They came across this pandemic situation and they are still fighting for the same. And I really thanks to all people who are working on the vaccine as well. And we assure you that we will follow all the norms which are, whether it's a mask wearing or the social distancing. And also, I would like to thank once again because of you people, we are working from home happily.
Yes.
So, wishing you all a very happy Diwali and safe Diwali. Thank you so much.
Thank you, Kanchan, for calling, and stay at home and continue to work from home for as long as it is possible for your own safety as well. Let me see if I can go across to Rinku on the phone line from Mumbai.
Hi, Rinku here, and I just have a message to say that I've heard of many types of warriors, but the COVID warriors are rare and doing such a fine job for the human beings. That they put their lives on stake while warriors are fighters, and they're fighting for human beings to save lives of people. I've got very high regards to all of them in the field and salute them myself. Wishing them a very happy Diwali and prosperous New Year.
Thank you so much, Rinku, for calling us and sharing, and sending across your wishes as well. Manish, if I can come to you. Again, the point that we were talking to even with our police department officials, with our fire department officials, the point of shortage of staff. How because many themselves got infected in the last 8 months, had to be treated or had to be in quarantine and isolation. How did the emergency services deal with that challenge?
So, in terms of the people on the ground, we've been fortunate that we've had the people staying on duty and not going home. So, what has happened is that most of the staff has stayed on a continuous shift where they've not gone home, and they have just stayed near the ambulance itself. So to that extent, our ground staff had not been affected. We did face an issue in one of our control rooms, which takes the calls for the which come into the 108 number. In that we had a case where the call center was infected by 2 people were infected by COVID, for which we had to shut down the call center and move it to 5-6 different places. So that was one off case where we had a shortage of staff. But besides that, the staff has been very good, and they have been coming and not complaining of doing long 15 days or 30 days continuous duty.
So, just for our viewers to understand this, especially those who don't come from such essential services who function through the lockdown, the kind of challenge it becomes, and Manish, maybe you can speak about it, and then Dr. Tushar Patel, to keep them effectively in a kind of a bio bubble where they can't go home, they can't meet their family, they have to be in a safe, secure environment so that they don't get infected. How did the planning and the logistics and, go into it on such a long, sustained basis?
So just to give you an example, we, as I mentioned, we have a call center which has about 300 people, which takes the calls for all the 108 calls which come in a particular state I'm talking about, Madhya Pradesh. What we've done for all the people, all the call center executives, is we've given them an accommodation in a hostel nearby, so they don't need to go home and they don't need to risk infecting their family members. And what we've also done is the food is also provided in the same place. And for the movement from the hostel to the call center, we have provided bus services which are exclusive for our call center executives. So to that extent, so what has happened is we are talking about call center executives that are like 18 to 21 years old, college going, and for them to stay away from the family for 1 month, 2 months, or 3 months at a stretch is quite nerve-wracking.
Right.
But they have stuck around and they have accepted the challenge.
In fact, Dr. Patel, I remember in the initial months, and we spoke to a lot of such COVID warriors who were staying in different locations away from their family, in guest houses and hotels and accommodations that had been arranged for them. So through the day, for 12 hours, 16 hours, you would be dealing with the pressures of handling the pandemic on the floor of the hospital. And then you would actually come back and have no one to even talk to or see, because you are by yourself in a completely different location. Was that a big challenge for many of your staff members?
Yes, this problem is occurring to our many of staff members and ourselves, because we are doing our same type of duty in our hospital for 6, 8, 12 hours, and then early stage, because in March, April, May month we are doing such 15 days duty and 7 to 10 days duty and 10 days for quarantine. Now it is not possible because our COVID work is also there and non-COVID work is also there. So what we are doing such type of work in our hospital also. So we are doing COVID work for 1 week, then 7 days quarantine, and then another work for the non-COVID. So this type of work pattern we are developing our healthcare facilities.
Okay, on that note, I am completely out of time, but it's been a pleasure to have all of you here, join us here. Again, thank you very much for all the services that you're providing and your colleagues are providing to us. I don't think, this year would have been, any better if it had not been for all of you and what you have done for us, from our policemen to our fire department officials, to our ASHA workers, our nurses, doctors, ambulance providers, ambulance drivers, everybody within the healthcare department. Viewers, think about it, especially for our healthcare staff members, to deal with it on a daily basis, to stay away from their own families, to then cover for those who've fallen ill and have had to be taken into isolation, to then now also have to take care of non-COVID patients, so that their challenges are actually going up. While we are feeling a lot more relief today than we were 6 months ago, and we are really taking the advantage of unlocking, meeting our friends and family members and preparing for a festival, they are only tackling more and more cases, COVID and non-COVID. Times are only getting tougher for them. So wherever you can, you must take precautions. You must do your bit of taking precautions, of not spreading the infection, and of supporting and standing by our COVID warriors. The only thing that we can do is make life easier for them, wherever they work, wherever they live, and demand from the governments to take care of them. It's unfortunate that even in these times we have examples of ASHA workers being beaten, not being paid well, of doctors and nurses in the national capital not being paid their salaries for 1 month, 2 months, 3 months together. Imagine that. Of a scheme that has been announced for as an insurance scheme, but that not being implemented on ground for many of the healthcare professionals. And their families now struggling for some kind of government support after having lost their loved ones to COVID. It's unfortunate that this is happening to our COVID warriors. I hope things get better from here on. A big thank you and a salute from Mirror Now's team to all of our frontline COVID warriors. Wish you a very happy Diwali.